Welcome back. As with many illnesses, just because you can't feel it doesn't mean it isn't there. Many Americans diagnosed with either oral, head, or neck cancers don't even recognize the symptoms, may not even be aware of the problem. And that's why one South Mississippi dentist's office is offering free screenings during Oral, Head, and Neck Cancer Awareness Week. Here with me now to tell us more about the screenings and what to be aware of from Beachview Dental, we have Dr. Andrea Elenbaas with us. Dr. Elenbaas, thanks for joining us.
Oh, thank you so much for having me.
This to me is a subject. I was reading 100,000 Americans who were diagnosed with cancers of the head and neck last year, and this is something we don't often hear much about.
No, in fact, oral cancer is the 6th most common cancer, and in the state of Mississippi, we're actually number 2 for the highest mortality rate for head and neck cancers. And the reason for that is because of late detection. If you can find it early, you've got an 80% chance of success rate with it.
Now, finding it early, I guess, starts with identifying and targeting symptoms, or at least who might be susceptible to it. So
that is
in terms, is it a genetic thing, a lifestyle thing? You
know, that's interesting that you said that. Actually, some of it is genetic. Other contributing factors are tobacco use, you know, smokeless tobacco, along with cigarettes, pipe smoking. The other one is alcohol use, excessive alcohol use. That's another common risk factor.
And so if some person suspects they may be showing signs, what would be some of the symptoms that they should be aware of?
Okay, that's a great question. First, it could be unilateral ear pain. You know, you could have pain in one ear. You could also have a hoarseness in your throat, or maybe a persistent cough. The other one could be a sore in your mouth or maybe in your throat that just doesn't go away. And lastly, you could also have some bleeding. You know, you're just kind of, having some bleeding out of your mouth that you're kind of like, why is that going on?
Yeah. And when they come to this screening that you're going to have, which we encourage anybody, and we've been seeing these rather graphic images, if you don't mind me saying, they seem a little graphic to me, but will you be able to even detect it at a screening like this?
Oh, yes, yeah. You know, in fact, you know, every year that we've had it, we've been able to diagnose oral cancers every year that we've had it, you know, and fantastically, you caught it early. Patient's doing great.
And that catching it early with so many cancers is really the key. So
that's correct.
Your message to somebody, if you find it, would be that there is light at the end of the tunnel. Right?
That's correct, yes. Yeah, so, you know, if you have any of those symptoms, definitely come by. The other one is that now we're finding a lot of HPV, which is human papillomavirus, is actually causing a lot of oropharyngeal cancers. And those are people that don't have any of the other risk factors.
Well, there you go, folks. You see a telephone number on the bottom of the screen. We encourage you to call. Beachview Dental will be holding this free oral screening the 12th through the 18th, or the 12th and the 18th?
Well, it's actually at it's that whole week but it's actually the 17th. From 8 until noon at our office.
Well, Dr. Elenbaas, thanks for being with us today.
Thank you so much for having me. I appreciate it.
It's something that people should be aware of if they think they might be having a problem. Well, a man is facing